Okay. Morning, everybody. Thank you very much for joining the White Plains City School District Reopening Committee meeting Wednesday, the 19th of January. Really quick update. As you know, we meet every Monday with the county as well as all of our regional partners to discuss what the COVID-19 landscape looks like in our region. So the good news to share is this, which you probably all know already, is that we are seeing a rapid decline of the identified COVID cases in Westchester County. It's still here. Don't misinterpret the good news for great news, but certainly far fewer cases identified in the last week than we saw in the previous week, the holiday week, and then the week following the holiday. So that's good news for the region. We've also seen a huge infusion of support from both the federal government and the state government with regard to access to testing, which is great. And the White Plains City School District is continuing to work with the state of New York and the Westchester County Department of Health and BOCES to get our tests and get access to testing. So we have tests. As you know, we kicked off our Test to Stay program this week, and we'll be able to continue to provide tests for the folks in the White Plains City School District. The federal government is also providing opportunities for every single citizen to get, I think, one free, air quotes, free test in the mail via the United States Postal Service. I know that link was shared, went out yesterday. I'm sure the Postal Service got bombarded with requests for testing. So, I mean, the good news is again, 3 weeks ago, folks were lined up for 3 hours to get access to testing. And now we're seeing, number one, probably that shouldn't have been the case, but number two, at least people now have access. In White Plains, we're in good shape. In our school district, we're in great shape. With regard to facial coverings, there's not been any change with state guidelines about masks in school facilities or on school transportation. I know a lot of people have very strong feelings on both sides of this conversation with regard to masking. What's important to constantly state and restate is that public school districts are not involved in that conversation. This is a conversation that takes place among healthcare professionals. We don't weigh into the epidemiological considerations insofar as public health goes. And what we have been advocating for is for clear information for parents and guardians so that they understand what the landscape would look like when we would start to see some of the health safety mitigation strategies no longer be required. So what would that look like? What can parents and guardians look for? Is there a community spread percentage? And to be honest with you, I don't think we have that information because I don't think folks know. I think they're still trying to figure that out as we have been throughout the entire course of the pandemic. I mean, when this started in 2020, everybody, we're in a huge action research project right now, right? And everybody is trying to figure out what the safest approach is going to be. So I know it's frustrating, and I'm not placating. When people are asking when can masks come off, I'm giving the best information that we have at this time. We saw that in a couple other places around the state, county governments had thought that they were going to instruct schools to determine whether or not they wanted to voluntarily wear masks. And very quickly that was rebuffed at the state level as some, you can't abrogate the law. Just so if anyone's thinking about that, or if folks are asking you, that's kind of where we are in terms of mitigation. We have always deferred to the medical professionals. We will continue to do that in cases related to medicine and public health. So we'll give you more information on that when we get it. In terms of school district operations, again, huge thank you to everybody in the school district for all hands on deck approach to supporting our children in our community. We were able to weather a couple of really tough weeks. We're still dealing with it. Folks are still dealing with illness at home. They're still dealing with illness of loved ones or themselves. But again, the numbers of those instances, fortunately, have been declining. Vaccination opportunities, booster opportunities will continue to take place throughout the district. We just had another opportunity take place, which was very successful. We are also, again, just in terms of PPE and supplies, we've ordered the masks that we need to be able to supply to folks who need it. There were also some changes at the state level with regard to guidelines last week, and then another iteration of those changes, which we communicated to everybody last week. And essentially, what this turns out to be is that contact tracing at the state and county level has effectively ceased at the moment. But folks have asked the question, well, wait a second, are schools still contact tracing? Well, for schools who participate in test to stay programs, you kind of still have to contact trace. You're not doing the length of or the depth of the trace that you were, but it's not that far off, because we still need to know for our children and also our colleagues who was a potential point of contact, and vaccinated or unvaccinated, we still have to know this information so that we can offer test to stay for students who may have been a contact. So we're doing that in White Plains. Folks have also asked, what about notification? I've heard some school districts are no longer notifying parents and guardians when there's an identified case in the classroom. So in White Plains, we've taken the approach that we always notify our parents and guardians of health safety concerns in a classroom. I mean, you'll recall in days before COVID, we would notify parents and guardians of cases of lice, or we would notify parents and guardians of a case of whooping cough. That was identified, right? So we believe that information in the hands of our community is important and it's powerful, and continues to support the trust, the bond of trust that we've established and continue to hopefully strengthen within our community. So we're going to keep letting folks know. And people have reached out 2 weeks ago. 100 cases at the high school. Yeah. That's what we were seeing. We had at one day we had 252, I believe, individuals in the district out sick. Those are real numbers. Those are big numbers, and we had to work through that. Fortunately, that's not where we are right now. But we still need to remain vigilant. We still need to continue to do what we've been doing to maintain and be successful. So that's why our reopening committee never stopped meeting. But you all have been really tremendous support, and thank you for everything you're doing in your sector of the organization. I do want to make sure that it's so important to me to hear from Dr. Longobardi. Hey, Doc, how are you this morning?
Hi, good morning.
Did I give a kind of a? Are you seeing the same thing in terms of cases, or are you still seeing really high numbers?
I think we're starting to finally see a decline. I mean, still a lot of people sick, compared to what it was before the surge, but it looks like in our area anyway that it has peaked within this past 7 days, it appears, with the numbers that come out every other day or so. And we're starting to see that in the office. We're starting to see that. So I hope that continues.
Cautiously optimistic. Yeah, thank you. Anything else from your side, Doc, that we could take into consideration or share with our community?
No, I don't think so.
Okay. With regard to testing, the PCR testing that's taking place in the district, one of the things that folks need to be aware of is that all the testing facilities were extraordinarily stressed over the last 3 weeks. So results have been delayed. We did make connection with our partner. They assured us that they will be notifying folks who are positive during the testing process here in the district, and that's that saliva test that you have to opt into, the rapid PCR. If folks haven't heard, there's also a number that they can contact, which is directly to our third-party provider. You need to provide your some identifying information to prove you are who you are in order to get that information. But all of that is accessible. They're also coming out with a fact sheet or an FAQ that we will share with you as soon as they have it, as soon as they give it to us. so that folks in our community can just follow that for the people who are participating in the rapid PCR testing. Ann, did I hit all those points?
Yes, Dr. Rick, and we're going to post the operations desk number for safety C19 on our website until we get that flyer. And, you know, if you don't, you know, when the test gets to the lab, that's when the 24-hour clock starts. So if you, for instance, I think, you know, today's Wednesday, if you don't have something by Friday, then call that number, because it could be something wrong with your email, but they'll help to get you, whether it's negative, you know, they'll help to get you that result regardless. They will be calling and emailing for positives, but their goal is to get the, you know, information out for negatives as well.
Great, thanks, Ann. Hi, Cheryl.
Good morning, everyone. So Joe, thank you for clarifying that we are still doing, you know, internal contact tracing, and as it relates to test to stay. That was a question I had asked as well. I also wanted to ask you to just comment on introducing test to stay this week. We had delayed initializing it in order to have those numbers in the, you know, community come down in terms of cases. So would you just comment, you know, for everyone who's listening, that at this point, you know, medically, we feel that we can sort of move forward now with the test to stay program?
Yeah, thanks, Cheryl. Great point. So just, you know, for anybody who's watching, a couple of weeks ago, the reopening committee considered test to stay as an option to support our children and to keep them in school as much as possible safely. We also, under, again, the guidance of Dr. Longobardi and Nurse Maggie, we decided that it would be prudent to wait to implement the program until we kind of crested, we came over the hump of the positives, and it made a lot of great sense, right? You know, implementing test to stay the first week back from the holiday while we were dealing with hundreds of positive cases probably would have been futile in a number of ways. So we delayed and we waited, and we determined that this week would be a good week to be in the process. And we started yesterday, so we're just in the very beginning. But at the same time, you know, it was good, and I believe that was a good call. So thanks to our healthcare partners in terms of making that short delay. Nurse Maggie, good morning.
Good morning. So we started this morning in the test to stay, and we do have some kids that were tested. Not many, because, you know, at this point we didn't quarantine as many, and we are still contact tracing, but it's turning out to be smooth so far. Great.
Yeah, and, you know, just as a reminder again to folks who are watching, test to stay only impacts children who are potentially exposed at school. So remember, there are some mitigating factors in there for being able to participate, and you have to opt in to do it. So when you get that phone call from your school nurse, you have the opportunity to test to stay as a parent or guardian. You can decide whether or not you'd like to do that, or whether or not you're going to follow the isolation protocol for that period of time. The links have been sent out as well, and I know they're available on the district's website too. All that information is there for folks to be able to consider. Thanks, Maggie. Okay, I'd like to go around the room real quick. I'm going to start with Mr. Pepper.
Good morning, everyone. Just very quickly, Dr. Rickett did touch on it, but our attendance rates are much better this past week than they've been the first week when we returned from the break. We were seeing numbers of employee absences, and this is all categories of employees, over 200, 215, 220. This week, we're seeing absences of about 130 to 140, so there's been a significant change in that. We do also have seen a slight increase in the number of substitute teachers that are now coming in, so it's all going in a good direction.
Thanks, Mr. Pepper. Anybody have any questions for Mr. Pepper? All right. Let me see. Dr. Hand, morning.
Good morning. Good morning, everyone. And to follow up on the attendance piece too, for student attendance, we asked Ron Velez to run attendance for us from September 9th until December, until we broke in December. And our attendance at the elementary level is an average of 96%, with a range from about 94.49 all the way up to 97.28. So very, very close. At the middle school level, it's 95% for average, and they are really going neck and neck. There's 1/100th of a percent difference between the two schools, Eastview and Highlands, with Eastview coming in at a slightly lower rate of that 1/100th percent. And at the high school, the average attendance is 92%. So that, we're happy that our children are coming to school. The other thing that we, that's instructional time for us, so it's very important. The other thing that I don't think that we announced last time, I'm not sure if we did, is the change that we made in the schedule for the midterm exams. Once New York State canceled the Regents exams in January, they haven't said anything about end of the year exams yet. So I want to clarify that, but they did cancel the January administration of the Regents exams, in consultation with the building principals and the instructional cabinets at each building. We've made next week a full instructional week, so it won't be a fragmented week of testing and assessment for the secondary level. So the 25th, 26th, 27th, and 28th will be full school days so that we can maximize our instructional time. So excited about that. We spoke about the quarantine instructional continuity program last meeting that we had. We are all set and ready to go with K through 5. Teachers have already began to check in to, with the students that may be on quarantine, and we'll continue in that at the secondary level too, with, with one-to-one tutoring to the, to the greatest degree possible. Sometimes it's in small groups, depending on how many children are quarantined in one situation. But as I said last time, we do have those content area specialists that are helping our students that, that are trying to keep up with their work when they're on quarantine. So we're putting in that extra support. Meeting with the principals later this week about the accelerated learning program. We are going to be starting an extended day program for 3rd, 4th, and 5th graders who need a little bit of a push to accelerate their learning, may have had difficulty in the hybrid model last year or in a remote only situation last year. So we'll be supporting that. And at the middle school level and at the high school level, we also have a seminar program for students who really were challenged by the circumstances of last year, and bringing them in for extra additional support, extra academic support in ELA, mathematics, and in executive functioning as well. At the kindergarten level, we're in the midst of kindergarten registration. We have a meeting tomorrow night for the a dual language parent information meeting. We hope that parents that are interested in the dual language program are going to attend that. We had one last week as well. We will have an overview video put up about the kindergarten program. And this year, I'm mentioning it because this year we are going to stay with virtual tours of the schools for our 5 elementary schools as part of that process, so the parents can familiarize themselves with the school buildings, and the principals will be sending out information about that virtual tour, when it will be conducted, and then it will be recorded and posted to the website as well. So that's pretty much our update.
That's great. Thanks, Doc. Anybody have any questions for Debbie? I do just want to draw attention, and again, thanks to everyone in the district, but mostly, huge thanks to our community. The attendance rates that we're seeing, go a long way to demonstrate how parents and guardians feel about the safety of our schools and how important it is for their children to be in school. I had the occasion to talk to somebody outside of the district about our attendance rates, and when I started mentioning in the 90s and mid and high 90s, they kind of looked at me, really? Yeah, and I think that goes a long way to showing how connected our faculty and staff members are with our kids, our support professionals. It's very, very important for our children to have access to their schools every single day, and more than the facility, the people in the schools. So, you know, the QUIC program, I love the QUIC I love the acronym, Tara knows, but you know, nothing will ever subsume or overshadow that connection, that in-person connection in the classroom. And we've seen that throughout the course of the pandemic. Thanks, Deb, for that. I also wanted to just move over real quick to Deb Algarton. Any updates, PPS, Deb?
Good morning, everybody. So we continue to build social emotional learning experiences for children and staff across the district to not only support our core SEL program, which has been in existence for many, many years. We use responsive classroom and developmental design, but also target strategies and supports that will help our community feel comfortable, cope with the effects of the pandemic, and ultimately heal. I had the opportunity this week to thank you, Mrs. Buck. Mrs. Buck's on the call to share with PT Council the types of strategies that we've been using in our schools, and every school has been developing their own social and emotional learning supports based on the needs of their children and the needs of their staff. So we have a wide range of things happening in the district. Andrus continues to provide both small group therapy to students as a mental health resource that functions outside of the parameters of our school district, but they've also partnered in providing small groups for teachers and for students to process stress and anxiety. We continue to measure our school climates and cultures to make sure we're meeting the needs of our students and our staff. And we continue to support the buildings with implementing things like mindfulness, small group counseling that can help students develop more robust coping skills. And of course, our goal for anything associated with social and emotional learning is really simple. How can you be a good friend? How do you be a good person? How do you manage yourself instead of responding in a very reactive way? Very basic. I'm always reminded of the book about kindergarten, right? Everything I needed to know about life I learned in kindergarten. Very basic themes and goals for all of us in a school community. So thank you, Dr. Ricca.
Thanks, Deb. You know, and it's so important to recognize that everybody processes trauma and stress differently. Some folks go for a good hard run, they're good to go. Some folks want to sit down and talk for an hour, that's what they need. Other folks just want free time. I don't want to talk to anybody. Don't bring me to a meeting. I don't need to hold your hand. We're trying to identify all of those different ways to meet people where they are, to meet children where they are. Because it's a unique experience, and we understand that. So, you know, some folks will take advantage of an opportunity to get together in a group and process together out aloud, while other folks, that doesn't work for them, and that's fine. So what Deb and the team have been trying to do is, you know, have an array of opportunities for folks and try to meet everyone where they are. One of the things that we know people need is rest. You know, weekends don't do it. Even holiday recesses don't necessarily do it. So looking for creative ways to try and provide folks with respite and a break is important. You know, we've talked to our faculty and staff members about making sure that their day has a beginning and an end. You know, that it's not just one long work day. These are skills that you have to work on, because you know your inclination is to be there all the time. But you can do that for a while, and some folks can do it for longer than other folks. But eventually, everybody hits their zone of proximal development, right? A little Vygotsky for you this morning, and you hit the wall. So trying now we're almost 2 years on, trying to manage that. Is another aspect of what we're doing. So in the district, for instance, we have been, when we have meetings, right, we're trying to leverage technology and allow folks to meet virtually when possible. We're trying to limit the number of after-school meetings to the extent that we're able. We're trying to provide the space for people to discuss what it is that's weighing on them top of mind. This is all important work. to ensure that we have the strength and the resilience as an organization to continue to serve our kids well. That's the point, right? We don't want kids just coming to school and, you know, everybody's kind of just getting by. We want people to thrive. So identifying those ways to support everyone in the district, it's a daunting task, but it's one that we're committed to doing. Any questions for Deb on PPS or any of the interventions that we have going on? Nope. Okay. Eva Karataish, where are you? I don't see you on my screen. There you are. Anything from business operations?
No, we're all good. I think Frank is picking up what, new tests. So we
More
just keep
tests.
plugging along. Yeah.
I think we were the first, Frank, to respond to that. I said, just give me everything you have.
And we have mask on order, so.
And that's on order. Okay, great. I want to just also, anybody have any questions for Ann or for Frank?
Sergio.
Serge? Dawn? I do want to touch base with our presidents. Adele, how are we doing? Any updates from your end?
No, Dr. Ricca, we are fine. Thank you.
Okay, great. Kara?
We're doing okay. I just wanted to echo the idea of our days having a beginning and an ending and being mindful of the work and additional work we're taking on and working to take some of that stuff off as well. And we might have to make some of those decisions for ourselves in order to take care of ourselves. Thank you.
Bet. Reagan, morning.
Morning, how are you?
Good.
All is good with the ASA. I just want to thank all of the administrators really for all of their hard work each and every day and to let them know that they are absolutely appreciated. So thank you.
Thanks, Reagan. I do want to thank our colleagues from the Department of Public Safety who are here as well. Thanks, Ed. And I do have to, and she knows it, recognize Detective Christina Brown. She was identified as the Police Officer of the Year, right, Detective?
Member of the Year.
Member of the Year.
Same thing, I guess.
That's fantastic. Congratulations, Christina.
Thank you, Dr.
So well deserved. All right. Any questions, general questions, comments, concerns about anything at all? Okay. We will be back in 2 weeks, see where we're at. We'll have an update on test to stay. We'll have an update on any potential changes related to guidance. And hopefully we'll continue to keep seeing those numbers decline. Now, if there's anything that comes up between now and then, I will be sure to reach out to you and keep you apprised of everything. But again, folks, thanks so much for continuing to take this time. It's amazing to me that this committee has been meeting regularly for 2 years. It's really a thing of dedication. So thanks, everyone. Have a great day. Oh, wait, before you leave, winter weather tomorrow. Just remember, tomorrow's shaping up, at least for the forecast, to be a really messy day. We've alerted our community that if we can't make, if we need to make a schedule change or potentially need to make a schedule change, we can't make that decision this evening. We'll do so no later than 5:30 tomorrow morning. So for anyone who's watching this and didn't get that message, please be aware tomorrow is supposed to be a dicey day, and we'll keep everyone posted. Stay safe. Have a good day, everyone.